welcome to the fourth and final session of the 2022 CEDIL conference. That is hashtag CEDIL22 if you're on Twitter, and please do tweet. It's a good chance to pick up some extra followers yourself if you tweet and use the handle, and people then retweet it and start following you. This conference and CEDIL overall, which stands for the Centre of Excellence for Development, Impact and Learning, which has been a 5-year project supported by UK Aid and the British people. And CEDIL is a consortium of London School of Hygiene and Tropical Medicine, 3IE, Campbell Collaboration, the Epicentre at UCL, hosted by London International Development Centre and with the Research Directorate in Oxford Policy Management, so consortium there. And as I mentioned, the overall management of CEDIL is Research Directorate, which sits in LIDC, and the Programme Directorate, which is Oxford Policy Management. This session is being recorded, so you're just sitting there listening. So if you object to having us recording you sitting there listening, then you have a chance now to leave before the recording starts. The chat box is disabled for participants, so you cannot speak, but you can ask questions in the question and answer box. So we have a Q&A box. We'll monitor that and we'll ask the questions to the panelists at the end of the presentation. So we encourage you to take part in the Q&A. And apparently, though I've not seen it working, apparently there's some function where you can upvote questions. I don't think you can downvote them, but you can upvote them so we can pick the best questions and make sure they get to the top. And at the end of the session, there will be, if you stay online and look for it, a feedback form to evaluate the session. So that's that. Moving on, so the topic is transferring evidence between contexts. So this is one of the, CEDIL has 3 programs of work, and this is one of our 3 programs of work, is transferability of evidence in various ways. And this is become a very topical question. When we picked it 4 years ago, it wasn't so topical, so we did a good job picking. This is one of our main themes for CEDIL. And of course, the critique is that individual studies, individual randomized controlled trials have limited external validity. So they might be really great, really strong internal validity, but their external validity, the ability to take those findings and apply them elsewhere, is severely limited. And so the interest in basically working out how you can transfer study findings from one setting to another, from one population to another, from one intervention type to a similar intervention type trying to achieve the same outcomes. These are questions for interest to policymakers, because policymakers generally want localized evidence. They will say, what evidence for my country, my state, my city, my street, my house, my family, whatever. And we want to convince them, no, you don't need that. You actually can look at global evidence from elsewhere, and under these circumstances, and help them understand why the evidence is transferable. So we have 3 great presentations lined up today, an excellent discussant, who I will introduce as the time comes. And so we're starting off with Professor Chris Bonnell from the London School of Hygiene and Tropical Medicine. So Chris is engaged in doing theory-based mixed method research, both for primary studies and reviews, both in developed and developing countries, around a range of issues. So I'm not quite sure what topics she's going to present to us today. And he's also a member of the CEDIL Intellectual Leadership Team, which I'm sure is the most prominent thing he puts on his CV. So Chris, over to you.
Lovely, thanks. I'm just going to share my screen. Okay, can people see that?
We can, but it's not, and it's a slide screen mode, so great, excellent.
Okay, yep. Brilliant. Okay, yep, so hello, I'm Chris Bonnell. I'm very interested in the issue of transferring evidence between contexts. Mostly I'll look at evidence and trials, but today I'm going to talk about something a bit different, how theory was used to inform COVID-19 behaviour change in the UK lockdown. Okay, so I was a member of the SPY-B subgroup of SAGE, which was a group of scientists offering advice to government on the response to COVID. SPY-B, I can't remember what it stands for, but it was basically a subgroup of behavioural and social scientists. So it included psychologists, anthropologists, epidemiologists, historians, sociologists, etc. We were tasked with developing a scientific basis for government communications for promoting adherence to COVID-19 prevention measures before and after the 23rd of March lockdown, which is 2 years ago in the UK. Now, Obviously, this was a challenge in terms of evidence-based practice because there were no evidence-based interventions to rely on, and there were no really any analogous interventions. Nothing of the same, nothing like this had ever really happened before. We needed to inform urgent and dramatic whole population behaviour changes. And we were uncertain at that stage in March 2020 which behaviours amongst which groups was contributing most to transmission. It really was an information-free zone. We assumed that many people would perceive themselves as low risk of the consequences of COVID. There was very little awareness of long COVID at that time, and there was also very little awareness about waning immunity and issues like that. So our approach, we opted to be informed by existing theories more so than evidence-based interventions. These theories obviously had varying degrees of supportive evidence from a range of other health topics, some of which were infectious diseases, but many of which weren't. We needed to make sure that whatever recommendations we produced aligned with the context, as I've just described it. We needed to make sure that government communications communicated clearly, rather than giving vague messages, and we had to be honest. So we reviewed a range of theories. We rejected some theories as completely incompatible with the above approach. So some of the most popular theories they used in public health, such as protection motivation theory, which is big in infectious disease prevention, and the health belief model, which is popular in many aspects of public health. We decided these were just no use whatsoever because the main construct really was perceived susceptibility to a particular condition and the consequences of getting such a condition. So we thought this self-protection kind of mechanism just wouldn't really fly with COVID because many people, a critical mass of people, probably didn't perceive themselves as very great risk. We also rejected disgust theory, which is a popular theory which interventions try and evoke feelings of disgust in order to promote activities such as hand washing. And this has been pretty powerful in other areas of infectious disease prevention, but we decided it wasn't going to be a goer for COVID prevention because it could very well evoke unintended harms of stigma and social division. So we rejected that as well, even though one of the members of SPI-B, Val Curtis, who's sadly now deceased, it was her main area of work. So other theories were more influential. One that was very influential was a theory developed by Susan Mickey of UCL called COM-B, and this was a key overarching framework for our thinking. COM-B stands for capability, opportunity and motivation. Capability is things like knowledge, attitudes, etc. Sorry, knowledge and skills. Opportunity is the opportunity to actually implement an action, and motivation is obviously the attitude and motivation towards an action. And we thought this was a useful organising framework, but it didn't go into the detail, the granularity about what actual messages we needed to produce. So we looked at other theories for that. Social marketing theory and moral foundations theory had some impact. So moral foundations theory is that interesting book by Jonathan Haidt that everyone was talking about a couple or 2 or 3 years ago. And this talks about how different people have different moral foundations at the forefront of their behaviour. So there are things like care, fairness, loyalty, respect, etc. And this influenced our thinking in terms of the possibility of using different messages for different types of people and different segments of the audience. And that kind of resonates with social marketing, which isn't a theory so much as a particular approach to public health messaging, which is all about using techniques developed from the private sector and applying them to public sector problems. So what we got from that was this possibility of audience segmentation. Probably the most influential theory on our thinking was the psychology of social influences. And this basically suggests the importance of building collective identity, a sense of altruism and care for others, and developing injunctive and descriptive social norms. Injunctive social norms means people's perceptions about what the rules are as far as their peers are concerned, what their peers find acceptable and unacceptable. So injunctive social norms. Descriptive social norms is people's view as to how their peers are behaving. And some evidence of this, of interventions informed by this approach, working some early data from COVID studies, but other data from previous health topics. And we thought this was a really good fit with what we wanted to achieve, because we really thought the only way to motivate behaviour change wasn't for care of oneself, it was care for others, and the collective identity and sense of common experience that was needed to underpin that. So this was very influential. Social cognitive theory was influential. I won't, talk about each of these theories in depth, but this was important in terms of emphasizing the visibility of adherence as opposed to the visibility of non-adherence. So rather than point out where people were cheating or non-adhering, we really tried to suggest to the communications people that they really need to get into the media images of people adhering rather than cheating. So that was quite influential as well. Another psychological theory that was influential was dual processing models. I won't go into details about what these are, but what this really was about was the need to break habitual behaviours and get people to consciously reflect on their behaviour. So what we thought this might be used within would be an approach which was encouraging families and households to develop plans for how they were going to change their behaviour with sort of if then arguments about what they might do in particular circumstances. So people's behaviour would be conscious rather than just habitual. So what were the messages we shared with the government communications people? Number one, we said you had to give clear, accurate information on what to do and not to do, be specific, impose restrictions because that's the only way of achieving massive population behaviour change, but communicate their rationale. Encourage the making of household plans in terms of getting food, exercise, social interaction, etc. Number two, focus on collective identity and care for others. Emphasise solidarity, not division or disgust, and multiple levels of belonging. So you can belong to a neighbourhood, a religious group, a nation, etc. But they had to be inclusive and not exclusive categories. We encouraged the comms people to use the voices of group members and those to be protected. So the most vulnerable, NHS workers, not just government spokesmen. We encouraged communications to communicate injunctive social norms about what was an acceptable behaviour to one's peers, trying to get that sense about, sticking with the rules because they're our rules rather than just the government's rules. And as I've already alluded to, a focus on adherence, not non-adherence in media advocacy work that the comms people would do with media outlets. We encourage to focus on empowerment rather than authority or coercion, relying on persuasion rather than enforcement. Encourage government to think about the material needs that people needed in order to adhere to the lockdown restrictions. A focus on equity. We kept on and on and on about the importance of equity and an importance of being sensitive to different groups' needs. We did quite a lot of work about different religious groups and, for example, arrangements about funerals and how government policy could engage with that in a constructive and supportive way. We encourage the use of implementation science, where possible, co-producing messages with communities rather than to them, and a use of logic models, in other words, being explicit about what activities were going to happen and how they were meant to actually generate the outcomes they were meant to generate. Okay, so reflections. In terms of good successes, we probably had more influence early on rather than later, as probably government communications people became more self-reliant and less interested perhaps in what the experts were saying, or interested in what the experts within government were saying rather than just the SAGE subgroups. The stay-at-home message was quite specific. The solidarity messages seemed to they did seem to feature in government communications. The furlough scheme was a powerful piece of policy which was about supporting people to adhere, and there was very high levels of adherence and public support early on, and a lack of authoritarian enforcement. There were isolated incidents of police authoritarian interventions, but they were the exception rather than the rule at that stage. What was less successful? Some faces here might suggest what the less successful elements were. Material support was perhaps insufficient. There was actually little attention in government policy to the household planning aspect. That didn't really kind of translate into communications. In the early stages, at least, there wasn't that much focus on co-production, partly because it was also urgent. There were probably some unintended harms from the communications, because the communications often said, stay at home, protect the NHS, and that inadvertently did lead probably to people who needed to go to the NHS not going to the NHS, not because the NHS wasn't there, but because they decided not to, put pressure on the NHS, and that obviously caused harms in terms of other conditions. Later on in the government's response, it felt like there was a drift towards much less precise and much more confusing messages. The obvious example being the sort of Stay Alert campaign, which really didn't follow any of the messages that we'd given to the comms people. And there was a gradual erosion of population trust and a sense of collective experience as a result of some policy failures and personal indiscretions. The obvious ones being Barnard Castle and the failures of the test, trace and isolate system. So conclusions in terms of the focus of this conference. Theories in effect were the means by which evidence from other contexts informed our interventions or our advice about interventions in a novel and urgent context. And this approach, I think, resonates with an increasing interest in evaluation informing broader policy via the contribution of evaluations to building and refining theory, and especially where this engages with contextual contingency. For example, realist theory is all about building context, mechanism, outcome configurations, which essentially are theories saying how a mechanism is theorized to generate an outcome and how that mechanism may play out differently in different contexts. A lot of my interest in trials is using those sorts of approaches to make sure trials contribute not merely to telling everybody what your effect size was, but actually describing what the mechanism of generating the effect is and how that might be different in different contexts. I think that's the way forward, and that's what theory is really for. We relied on established theories, but assessed these really in terms of face validity and whether they fitted with our needs, rather than doing any kind of thorough assessment of the pertinence and the rigor of the evidence base. If we'd have had more time, that's what we'd have done, but we didn't have time. Okay, thank you very much for your attention. There's some references for the people with good eyesight and interest. Thank you very much.
Okay, thank you very much, Chris. Very interesting presentation. I was a bit concerned at the start when you said, okay, well, SAGE relied on theory, not evidence, but you came back at the end and said, actually, you were interested in the way in which evidence supported different theories or not. And the emphasis you put on it's using evidence to actually test specific causal processes or causal mechanisms that explain why theories may or may not work, which is precisely where CEDIL, in the use of mid-level theory, is going in trying to enhance transferability. So I think and it's very consistent with the approach we're using. So it's very nice to see this example of that being applied in practice. And then you also said at the end about understanding, I forget actually what we said now, but what I wrote down was the average treatment effect is rarely what we're interested in, is actually the variation of the treatment effect across different population subgroups and so on. And for those that came to yesterday's presentations on big data machine learning, with machine learning approaches that we have now with these causal forests allow us to get individual effect sizes basically from the data, or at least effect sizes around particular covariates. But those looked at the presentation yesterday, they're fairly theory free. So it's like, here's what the data says. And so I think there's still a challenge to get these machine learning approaches to wed up with the more theory-based approaches to actually understand the mechanisms rather than just say, oh, here's a bunch of covariates that have varying effect sizes. So I think that's all interesting stuff. Okay, thanks, Chris. So over to our next speaker, who is Sherry Kullenberg, who is the Senior Advisor for Research and Evidence at the International Rescue Committee. If you're not familiar with IIC's work, then please check them out. They have a very nice, they're very evidence-based organization. They committed some time back to be entirely evidence-based by last year, the year before now, I think it was, which means all the programs they support have an evidence base to them, and they've been one of the primary implementing NGOs that actually commission rigorous impact evaluations, or have commissioned, have managed to get commissioned rigorous impact evaluations of the work they do. So they're not a agency like JPAL or IPA, who are just a research agency. They are an implementing agency, but one that is very keen on producing evidence and using evidence. So Sherry, over to you, please.
Thank you so much, Howard. Good afternoon, good morning, everyone. As Howard mentioned, I am Sherry Kullenberg. I sit within the Research and Innovation Department at the International Rescue Committee. And it's really our pleasure to be invited to share our experience and our approach to using evidence across contexts within the framework of this conference. And although the incidents over the last 2 years of the pandemic and how that has manifested in several places is probably the trigger for talking about using evidence across many contexts. I thought it would be helpful to share our overarching approach and how we have evolved on our journey towards becoming even more evidence-based and evidence-generating in our work. Of course, some of what I will refer to has only been underscored and sort of revitalized because of our response to the pandemic, and I'll be sure to flag those. But again, I thought sharing our overarching perspective and approach would be helpful here. So for those who don't know, the IRC is a humanitarian organization operating mostly in conflict and disaster affected contexts. And here's our mission: to help people whose lives and livelihoods have been shattered by conflict and disaster, including climate crisis, to recover, survive, gain control over their future. As Howard mentioned, in 2015, as a strategic priority for the organization, we committed to being evidence-based and/or evidence-generating in all of our programming. And so the Evidence to Action team, the team that I lead, and all the functions therein was born. And part of our operationalizing that commitment is developing an outcomes and evidence framework and an interactive version of that framework, which I'll demo in just briefly. We also established an evidence-based decision-making process, which is basically reviewing the most common interventions implemented within IRC against the best available evidence, impact, and cost evidence, bringing in implementation insights, questioning the theory of change behind interventions, and then making a recommendation about how confident we are that these interventions actually achieve the desired outcomes. And then we have a more bespoke support model that is more around supporting our program teams at country or regional level to make strategic decisions as needed in their own context, using evidence and a host of other informational inputs. But today I want to focus on our outcomes and evidence framework and how we've evolved in this work. And so again, introducing to some, but just refreshing the memory of others, here is the interactive outcomes and evidence framework. Is a publicly accessible platform, meaning anybody can use it, no login required. And we've used this as our framework for articulating the outcomes and outcome areas that IRC is committed to working in, right? So health, education, economic well-being, power, and a cross-cutting area called service delivery. You can click on any of these to get the definition of what an outcome is, and that will also bring you to, as soon as it loads, an interactive map that should give you each of these pathways, right? And these are basically our sort of most informed and educated guesses about how we achieve this higher level outcome, right? So for example, in education, we have this outcome around school-aged literacy, numeracy, and social emotional learning skills for children according to their developmental potential. And these are sort of like the pathways to getting towards that outcome. And each of these we consider a sub-outcome. And the way that we constructed this OEF was that anybody, including our program staff, of course, could just click on an intervention or a sub-outcome area and see what interventions and indicators and cost efficiency data and information would be available. And we populated this sort of intervention panel, just pulling on the fantastic work that has been done by 3IE, Campbell's collaboration, a number of other, Research for Development, a number of other entities around systematic reviews and in some cases impact evaluations, looking for an assessment of the evidence, the strength of the evidence, the quality of the evidence around these interventions that are linked to the outcome of concern, right? And so we read the systematic reviews, kind of pulled the top line takeaways and tagged whether there is negative or null evidence, the type of populations and context and target age, and then provided a link to the full study where it's available. So this is the version of the OEF that we launched in 2016, 16. And now what I want to show you is how we're evolving our thinking, right? So you saw the evidence card that I just showed, and it basically had just top line takeaways for interventions. Based on our engagement with our field teams in particular, and our technical staff that are more at regional and headquarters level, I mean, something that Howard said earlier on resonated completely, where our staff are far more interested in evidence that's relevant for their own context, right? So what about my context? What about the specific populations that I'm working with, and so on and so on. So what we are doing, prototyping, and this is very early days, we're prototyping another way of bringing out evidence takeaways and combining those takeaways with other key information that are important for the decisions that our field teams and technical teams are making. So over here, this is basically just a scaled down version of what you saw earlier.
Sherry, so
Yeah.
we're still seeing your last slide. We're not seeing anything else. You're sharing something else. I think we have to stop sharing and reshare.
Oh, I'm okay. I'll stop and
That's
reshare.
stopped. Yeah.
Okay, I will reshare, and let me know if you're seeing.
Now we've got it. Yeah.
Okay, thank you so much, Howard. That's what I get for toggling between screens. Okay, so this is our prototype for a new evidence card. And you don't need to read all the information. It's just an idea. I want to point out the different ways that we're trying to share evidence and bring evidence together with other types of information that are critical for programmatic decision making, right? So we have outlined what we call the pathway and the sub-outcomes that a particular activity or intervention is linked to. In this case, we're talking about collaborative content adaptation, with parents and children, all right? And this is an education outcome. And so what we've done is we look at impact findings, both quantitative and qualitative evidence. I mean, most of our work is done in humanitarian, fragile, protracted, conflict-affected contexts. And while there is more quantitative impact evidence in those, a growing evidence base in these contexts, we still don't have a whole lot to go on. And so impact findings of the i.e. systematic review ilk is still very important and valued, but we've been hearing even more desire for the best available evidence, right? And of course, what we've done is we've indicated what types of evidence are available, but then we've also indicated our confidence level in the type of evidence based on the quality, based on the inferences that can be made from that type of evidence. We've also heard the desire for operational or implementation evidence. So we've tried to bring in studies as best we can that can articulate takeaways that are important for thinking about how do I do this intervention in a context like mine? What are some of the key operational insights that would help me to decide whether this is even relevant. And we also give a sort of ranking or confidence around the operational evidence. We look for cost data of any kind and provide it where it exists. We also try to pull out, and this we work with our technical teams to do, we try to pull out the indications for relevance for IRC. And here is where, I guess our systematic reviewers and researchers would call it the PICO plus type stuff. Like we really try to hone in on what are the specific populations that have been engaged with this intervention under study? What are the specific types of contexts, not just urban, rural, not just a country, because we work in many, many different contexts within a given country, right? And what's the delivery modality? Many times systematic reviews and even impact evaluation primary studies don't tell us much about these things. And so if there is one request for improvement, it would be around the depth of information that's provided here. We try to talk about other things that are strategically important for our organization. So the types of partnerships that are important for delivering on this type of intervention. Cash and voucher compatibility, that's a priority for us, whether this can be scaled or bundled with other activities. And here we provide references at the bottom, but we also link in to a full evidence synthesis, programmatic guidance, examples from IRC projects, what indicators are used to measure change or progress along this activity. Implementation insights is what I'm calling programmatic learning from our implementers themselves, right? So much of it is tacit, and so we're trying to figure out ways to draw that out. And then we want to also get feedback or insights from our actual clients, the actual beneficiaries of an intervention. So all of this is, again, early days, a prototype for bringing together, well, first of all, determining what types of evidence are relevant, pulling out the key findings and bringing together other bits of information such that people can make, our implementers and others can make informed decisions about whether a specific activity is relevant to their context and should be operationalized. Right. That's it. Thank you.
Okay, excellent, Sherry. Thank you very much for that. Okay, so we move straight on to the third speaker. Please keep the questions coming. There are a few in the Q&A. Participants do take a look at the, presenters do take a look. There's a couple of very specific questions for you, Chris, right at the start there. If you can actually answer them in the chat is also fine. So now we're over to Patrick O'Quinn, who's the team leader in eBase in Cameroon. I'm not familiar with eBase's work, started in health, but moved over into education as well, which is what Patrick's going to be talking about today. And with CEDIL support, working with the Education Endowment Foundation, which won the UK What Works Centres, they've been looking at actually transferring knowledge products across in the West African context. So Patrick, over to you. And we can see your screen perfectly. Great.
Okay. Thank you very much, Howard. So today, I'm Patrick O'Quinn, and I'm the team lead at eBase Africa. And today I'll be talking about how we use meta-analysis to explore the transferability of education mid-level theories to Cameroon, Chad, Niger, and Nigeria, what is commonly known as the Lake Chad Basin slide. So on this slide, we can see, just to put you into perspective, to understand where the 4 countries we've been focusing on is located. It's actually located in Middle Africa, and they all share the boundaries with the Lake Chad. Slide, please. So generally, when they talk about the Lake Chad Basin, it includes actually more countries than just Cameroon, Nigeria, Niger, and Chad. It actually extends to about 8 African countries: Algeria, Central African Republic, Libya are also included. But the main conventional basin is Chad, Niger, Nigeria, and Cameroon. And these are the 4 countries in which the work that we did in this transferability project was located. Slide, please. A common example of these countries is that they have certain issues that is affecting their educational attainment. Slide, please. So, first, there is quite a lot of the poverty burden is really high on these communities, and then access and retention in school is also a problem. Quality of education is still poor. Governance is still an issue, and safety and security is always present because there are many outbreaks of disease that come up from time to time. For example, in Cameroon, we now have the cholera outbreak, which is affecting up to 2 regions in Cameroon at the moment, and it's rapidly spreading to about 3 regions. Nobody hears about it because it's stuck in this area. So education has improved in this community. This we must accept, but there are still huge issues around poverty, governance, and safety that still affect the quality of education. Slide, please. So in this infographic, we have this infographic for the 4 countries in which we interact. It shows issues around literacy and numeracy, attainment, equity, and evidence in policy. And the interesting thing about these countries are that most of them, the per capita is around below 2,000 US dollars. And to put this in perspective, a country like France or UK is at about 40,000 per capita. So all of this tells us the importance of looking into issues around equity if we want to improve the quality of education. Slide, please. So I'll just dive into how we go about predicting transferability. So our idea is that if there is global evidence, if funds have been invested into developing, into research that brings out evidence on a particular teaching and learning intervention, it may be useful for us to first understand if we could use that or if we could transfer that to our setting rather than starting off completely new research on that topic. So what we have set out to do is to take the global evidence, engage stakeholders, discuss around transferability, then use mathematics to model the evidence to see possibilities or to predict if this can be transferred to our context. And then once we see that this can be transferred with minimal investment, then we try to get this to local decision makers. And if it cannot be transferred to into local decision making, we start looking out for how we are going to work with government or development agencies to find funds to actually evaluate the interventions before rolling this out in local settings. Slide, please. So our first step in getting global evidence to local decisions is actually looking at the global evidence itself, searching databases, and in essence, our toolkit was inspired by the EEF Teaching and Learning Toolkit. Then we search evidence from different databases, including Campbell Collaboration, Cochrane, especially if this is health related, but especially development agencies databases, because they have reports and evaluations that they have done, which ends up being the best available evidence that we can use in our context. Some of them which actually have enough data, enough information to allow you to model them into decision making. So development agencies websites we use include the World Bank, but also UNICEF, other UN organizations as well. Slide, please. Our next step is actually engaging stakeholders, because when you take the intervention, you want to be sure that this intervention, the community where you want to roll out the decisions that will be made from this evidence, are actually interested in this kind of intervention. And we use an approach that we adapted from the BCure approach, where you use power and interest to map out your stakeholders. And then you analyze who has power, who has interest, who lacks power, who lacks interest, who lacks both, or who has both. Because you can use this once now to have a power play or an interest play to move people around to take up new educational technologies. Now, our stakeholder engagement sessions usually go in the forms of key informant interviews and focus group discussions. And then we analyze the stakeholder, the feedback or the comments or the qualitative data that is coming out of the stakeholder analysis. Then we apply the stakeholder feedback to our transferability model, which we'll be seeing shortly. Slide, please. Now, when we talk about discussions around transferability, we actually go on to explore interventions that are behind the teaching and learning strand. For example, you can see that an evidence review on arts participation, an evidence synthesis on arts participation, actually different studies looked at different kinds of interventions. Some looked at structured arts activities, others looked at extracurricular activities, some at incorporation of music, and some at arts participation. So what we do is that we look at the outcomes that they have measured. And then during our stakeholder sessions, we talk with participants to find out from them whether each of these interventions are relevant to their context. And this is particularly very important because relevance tells us whether the culture accepts this kind of intervention, whether it addresses certain contextual issues like poverty, corruption, safety and security as well. Then we look at the complexity, and then we also look at the cost. And when we look at the cost, we actually use the cost as given by the stakeholders, and then also we use TPP. Slide, please. In predicting transferability, we use mathematical formulas to try to get some probabilities as to whether if we transfer this intervention to our context based on the research evidence, it will work. So we consider the relevance, which came from our stakeholder sessions. We consider the complexity as well, which comes from the research and our stakeholder sessions combined. Then we consider the cost, which is based on TPP. And then we also look at the importance as set by teachers, policymakers, and users. Then we look at the impact, which is the effect size. And here, it's very interesting, the comments that came from Chris talking about the importance of really defining how the effect size is, because this facilitates people who will use the research results. And the model expression that we use is the CAT algorithm, and it's specifically the Gini impurity index to create sequential questions that our modeling tool can answer. Slide, please. Then the next thing we do is to try to sit and work with the stakeholders again to predict the transferability of future interventions, and also work with policymakers through policy events. Now, the relevance of intervention is used as the root node because it considers contextual challenges, as I mentioned earlier on, and looks at households and practice needs, then governance, etc. After all of this is done, based on the score, we can tell if an intervention is transferable. It's transferable with minor modifications, transferable with moderate, major, or it's non-transferable at all. In the three last cases where there's moderate, major, or non-transferable, before we can roll out this kind of intervention, we will recommend that further studies should be conducted to be able to inform that process. Slide, please. Now, local decision-making is facilitated by, first of all, the e-based teaching and learning toolkit, which is available on the link that is on the slide, which has now put up to 30 strands, including new strands that have not really been considered by other evidence portals in the past, which we are going to see later. And for example, here we can see, we also use capacity building for policymakers and practitioners through policy events and things like this. Then we use storytelling for households and citizens. We use CEDIL, which are forums where we bring together teachers or policymakers to come and talk about what they do to see if we are on the right process. And then we also use evidence summaries because this we can share by email to teachers and policymakers. And then we are also using audits and feedbacks for teachers. And at the moment, we are actually rolling audits and feedback in 40 schools to reach 100 teachers and 10,000 kids as an offshoot from this project. Slide, please. I'll just run through a few examples. For example, feedback is an approach that is used in teaching and learning. And here, this is what our toolkit says about it. This is an intervention that is transferable. We don't need to do any further research based on our transferability model. So we can roll this out in our context without much worry. So we see that the feedback it has very high impact for moderate cost based on extensive evidence. The three calories that you see there shows that there is moderate, it's a moderate cost for the intervention to be rolled out. And the 4 locks that you see there means that there's extensive evidence, especially in our context, that this intervention, corroborates the effects of this intervention or the impact of this intervention. And the +6 stands for 6 months. And this means that if a child who is undergoing a feedback based on the approach of effective feedback will actually be 6 months ahead of a child who is not doing the same thing. And this is currently being rolled in 40 schools in Cameroon, Niger, Nigeria, and Chad, and has a 1-year funding from EEF. Slide, please. Now, performance pay is another intervention that showed that it's transferable, but with moderate modifications. So we had reached out to the World Bank in Cameroon, and we got some funding for this intervention, which we are actually concluding on the pilot at the moment, and we'll be able to tell if the effect size is increasing or is reducing. Slide, please. Menstrual hygiene management is a completely new strand, which based on stakeholder engagement, we realized that Unlike what is in the UK and other parts of the world, menstrual hygiene management is an important intervention that we need to bring into our schools. So we roll this in, and then we also got some funding from EEF for the global trial, and we are rolling this out in 15 schools in Cameroon. Meanwhile, cash transfers is also a new strand which can potentially address demand side, which still needs testing and has not yet been rolled out because there's definitely been no funding. Slide, please. So thank you. This is where I come to my end, and I'm happy to receive any comments and questions on that. Thank you.
Okay, thank you so much, Patrick. Very interesting presentation. So again, I welcome everyone to put questions in the Q&A session, in the Q&A box at the bottom of the screen, and we'll get a chance to come to those questions very shortly. But first of all, we have Annette Brown, who is the, I'm going to try and make a joke, please pay attention. I was practicing a lot earlier. So she is both principal economist and a principled economist from FHI 360 in Washington, DC, and is also acting head of strategy at FHI 360. And so Annette is going to give some reflections on what we've heard so far this morning, this afternoon. Over to you, Annette.
Thank you, Howard. So I want to start by thanking the presenters for 3 really interesting presentations. And what I really like is that they all touched on different ways of looking at this question or different stages of looking at this question. I'll start quickly by talking about Dr. Akwin's presentation. I think what's really important here for others who are thinking about transferring evidence is matching the information about the interventions that were being tested or about which we have evidence to what is going on or what interventions are planned in the new environment. I think we see a lot of times that people take a simplistic idea of what the intervention is and then say, okay, we know that there's good evidence for cash transfers, so cash transfers must work over here. And so this very careful process with stakeholders for really understanding the relevance to the context of the intervention as designed, I think is really important for others who are thinking about how can we transfer evidence to our current environments. Another point that I'd like to highlight from that is the importance of complexity. It is much easier to transfer, I think, very simple interventions to new environments where you have a very well-defined intervention that leads directly. The theory is this intervention will lead directly to this outcome, and we have a lot of evidence that shows that it does. But the more complex the programs were that contributed the evidence, and the more complex the program is that we want to design, the more important it is that we look, I think, that we look at single studies of that complex type of program next to the specific design that we're thinking about in our new environment. And I will come back to, the discussant always has to bring in her own research, so I will come back to how my own research helps to demonstrate that point. But first, let me talk about Cherie and Chris's presentations. Again, anyone who knows me knows that I love to talk about theory. And so Chris, starting with theory and even starting with thinking about the face validity of theory, I think is so crucial, particularly when we're looking at behavior change. So often now in the environments that we work in what we call development, low and middle income countries, but as Chris rightly demonstrates, we're looking at many of the exact same issues across all the countries around the world. And so many of these programs are about behavior change. And when we go back and look at the theoretical basis we have for behavior change programming, we realize there are a lot of different theories, and the evidence base underlying them can be confusing. So even starting with face value is important. One question that I have for Chris is, I'd be interested in what you personally, how you updated your own face validity understanding of these behavioral theories after seeing what's happened over the last 2 years of COVID. When you were presenting those theories, I realized that in my own head, I was updating my understanding or my belief in some of these behavioral theories. just using my anecdotal evidence of the last 2 years. But both Cherie's evidence cards, where you have the what do I want to say, the theory of change or the logical framework for getting to the outcome, and Chris showing how we started with theories and we might have seen different outcomes, really reinforces for me the importance of having an evidence base that doesn't have one set of studies linking our theory to intermediate outcomes and another set of studies linking those intermediate outcomes to the final outcomes, but that really includes evidence that brings us all the way through that theory of change. In Cherie's card, you saw that it said, we have good evidence that we can change these behaviors up here, but we don't have evidence that that's leading to the outcome or the final impact that we want to achieve. So bringing in my own research, I recently conducted a rapid review looking at programs that are trying to change social norms with the idea that those changes in social norms will bring about behavior change. Because that review was meant to directly impact the design of programs in my organization, we said we are only going to include studies that measure a behavioral outcome, right? And what we saw when we did that is that you had within those studies, a lot of studies that measured a change in norms and no change in behavioral outcomes. And we also found studies that didn't measure a change in norms using the metric that they had, which brings up how we measure norms, which is a different topic, but did find changes in behaviors. And often these were complex programs, which comes back to this idea of the more complex the program, the more specific the studies need to be that you're using for your evidence, where these complex programs didn't show a measurable change in social norms and still showed a change in behavior. And further anecdote, when I submitted this to a journal, the reviewers came back and said, why isn't she talking about the changes in norms? We want to see whether the study measured a change in norms. Did the intervention have a change in norms? Well, why does that matter if the intervention didn't have a change in behavior? And behavior is what we ultimately want to achieve. But people who design social norms interventions want to know whether they're changing social norms. So all of that comes back, I guess, to what I think are three, I guess, important points I want to make about transferability of evidence. First, really drawing on Patrick's presentation, the more complex the program we're designing, the more important it is that we have evidence that applies to that type of program, that complex program. The second point is that we need to make sure that we have evidence that is showing that a change in something leads to a change in something. So not evidence that injunctive norms influence behavior, but that we can change injunctive norms and that change leads to a change in behavior. And finally, that when we're using middle level theories, we have evidence supporting those theories from the same intervention in one study, and not using one set of studies to show that we can change norms and another set of studies to show that norms can lead to behavior change. I'll stop there.
Okay, thank you, Annette. So we actually have a large set of questions now. I hope the panelists are having a chance to read through them. So Sherry, there's a number of questions for you. One is about simply whether the OEF is available online. I know it is, but we want to try to share the link. I'm less sure whether the new version of the evidence cards is available online. And someone also wanted to ask about how you keep it updated, and also okay, how do you get updated? Do you give any priority to IRC evidence over other evidence in creating the OEF? And finally, what's the opportunities for programs to share their experiences to inform what's going on, what's contained in the OEF?
Okay, so I think there are probably 4 questions, and my apologies everyone for not currently sharing the screen. This is the interactive OEF. This is what I was talking through before going to the PowerPoint slide. So oef.rescue.org is the website. It is publicly accessible. Anyone can use it. When you scroll through, you'll see that there are many interventions and outcome areas that we're looking at, and you might see a lot of gaps because this version of the OEF is based purely on systematic reviews and maybe in a few contexts looking for impact evaluation evidence. So most of the evidence here is based on systematic reviews. Again, oef.rescue.org. So sorry about that. I'll stop sharing now. So back to the questions. From our side, from the research and innovation side, we do not privilege IRC generated evidence over other evidence. We treat it equally, especially from a critical appraisal standpoint, right? So it's looking first at the quality and usefulness of the evidence. Of course, our teams would prefer to refer to our own evidence because they're usually linked to our own programming. Not all the time. Sometimes it's standalone research that's not evaluating a program, but usually they prefer IRC evidence and they find it more believable. But our approach is to bring together the best available evidence generated by whomever. And to critically appraise with the same lens. And I think some of our teams find it a bit disappointing when we come out with, confidence levels around some of our own studies that are not so great. Not for the methodology, but just for the inferences that we can draw, right? In terms of updating the IOEF, this version, the resources needed to both update and deepen the breadth of, broaden the breadth of evidence there, and the types of evidence required for our new version of the evidence guide is quite extensive. So in the past, we updated the IOF every 2 years, just pulling on systematic reviews. That was relatively easy enough. But now with this focus on impact evidence, operational evidence, and the cost data, that takes quite a lot of human resources just to search all these different relevant databases and to pull the information together in a way that makes sense. So we have not updated the IOF platform with that level of information just yet. We're really only starting this process. In terms of the prototype for the new evidence card that I showed at the end, that is not publicly available yet. We're still working through it internally, but I thought I would share it as the direction in which we are moving. Our hope is that by the end of fiscal year 24, that we'll be able to have these up and populated and in the new version of the IOEF. Was there another question?
So I was busy answering other questions while you were doing that. Did you answer about the update, keeping it up to date?
Yes, yes.
Okay, so there's one question I didn't ask, which was about beneficiaries, and you did mention beneficiaries in your own presentation, which that was interesting. So how do you think this tool might be? How do you try to communicate what's in this tool to the beneficiaries of your programs?
Okay, so there was another question before that I missed. It was about bringing in, I think, learning or programmatic learning
from other programs. Yes.
That's great. So that very last prototype that I showed you in the evidence card, we are working on using our business processes around programmatic review and project level learning to pull out what we're calling implementers insights or implementation insights. And that is not research. It's really just the wisdom that folks have gained over years of implementing a particular type of intervention or set of interventions across many contexts, or sometimes many times within one context. And so we want to not only extract that in a project by project way, but also develop a sort of community of learning that is across countries, right? So this is why we want to elevate examples of actual IRC projects that are relevant to that intervention card, right? And to also tie along with that, the learning that comes from our implementers, right? So we're hoping that this will be, in a way, community sourced, right? IRC community sourced, and that it will generate not just more frequent use, because someone asked, how do we ensure that folks are actually using the IOEF? We have a lot of business processes that are anchored on the content of the OEF, so people just have to use it. But outside of that, we're trying to generate more enthusiasm and excitement to use it, because some of the inputs are generated by our own staff, right? To link that to the client question. So the way we think of our clients, when we use that at IRC, we mean our intended beneficiaries. We find the term beneficiaries a bit, sometimes we're not sure that folks are benefiting, right? So we want them to benefit, but we want to think of the people we're serving as our clients, because we also want to recognize the power that they should have around choosing to interact with our interventions and how. So there's a whole stream of work that sits outside of the research and innovation unit around client responsiveness, right? So this is looking at everything from not just client feedback, but actual client participation in thinking through what we do on the ground, in making very clear what their preferences are around priority areas of investment and so on. So how we try to link that to our work here, again, this is all a work in progress. We don't even have a sort of full model worked out yet, but we want to link all of that work that's happening in that pillar to the interventions that we're reviewing against evidence, right? So such that if we've implemented, let's say this, content adaptation example that I gave, let's say we've implemented an intervention of that kind in a country, and we have client feedback on that specific intervention. In one context, two, it doesn't matter, right? We want to make sure that anyone who wants to make a decision about whether to implement this again or to adapt it for their context has access to those insights, right? Saying, look, the feedback was positive along this regard, or along these points. I think your question was slightly different, Howard, about how we make this information accessible to clients. We don't. That's the honest response. We don't share our outcomes and evidence framework as it is in this platform with our clients directly. What our field teams do is that they share a version of the theory of change, of the description of the outcomes that's represented in this OEF with our clients, usually, of course, translated in many different languages, to say, here's how we're thinking about the work that we're doing on the ground. Does this resonate with you or not? Would you prefer a different type of outcome that we focus on, and so on? Actually, a big part of the work that we're doing right now is figuring out how do we grapple with client preferences and evidence and partner insights when these things just don't align, right? And political constraints and donor demands, they don't always align. So how do we grapple with all of those things? The last thing I'll say is that what we do share, the OEF, we share that as it is with our partners. So people who are in country, in regions, in governments, whomever our partners are, be they implementing partners or thought partners or policy partners, the OEF, those are the people that we share the OEF directly with and say, here is our overarching framework, and here is how we think about trying to achieve these outcomes. Does this resonate or not? At what entry points do you think it makes sense for us to collaborate? I'll stop there.
Lovely, thanks, Sherry. So following directly on what you said, I've got a question for you, Patrick, which I'll prelude with a short monologue. So as Patrick explained, he's working with Education Endowment Foundation in the UK, which actually for England, which is the What Works Centre for Education. And specifically, EEF have what's called the Teaching, as Patrick explained, the Teaching and Learning Toolkit, which I call the best website in the world, so I clearly quite like it. And what's striking about the toolkit, the Teaching and Toolkit, is that evidence that they gather is that they've collected from schools across England, which is their catchment area. So 75% of schools, I'll say again, 75%, 3/4 of schools in England use the toolkit to make decisions about what to do in the classroom, how to allocate school resources, and so on. So 75% of schools in England are making evidence-based decisions based on systematic reviews, not because head teachers in schools are reading systematic reviews, they don't know what a systematic review is, but because you have this really great evidence product that says, here's what the evidence says, you decide what to do about that. And it's as Patrick didn't go into presenting the toolkit in detail, but it basically does show very clearly the impact of different approaches and so on. Now, how have they achieved the 75%? There's two principal ways in which this has been achieved. One is there's something called the pupil premium. So which is basically what's called in the US evidence-based financing, evidence-based budgeting. So schools are given a capitation grant according to the number of disadvantaged students they have, number of students receive school meals in their free school meals in their school, and they're told use this money to increase the learning outcomes of disadvantaged pupils in your school in an evidence-based way. So what they're going to do, they go to the toolkit. And secondly, though, and I think this is important, when you look at the use between EEF toolkit and its comparator in the US, the what was Clearinghouse for Industry Education Sciences, use rates in the US are much lower, despite actually present evidence-based budgeting in the US. And that's because EEF did a lot of outreach. There are a lot of workshops. And if you look at the toolkit, it's like, it's really easy to use, you'd think. But there's a lot of outreach with stakeholders, both in developing the tool and in actually how they should be using the toolkit in order to inform school decision making. So my question to you, Patrick, and there's a question also in the QA on this, is what outreach work have you done, Patrick, on getting intended users to use the toolkit? What do you know about use of your toolkit? And in the Q&A, there's a question about, do you know of other agencies sort of taking up the work you've been doing, promoting it also? Because other, not only EF promotes their toolkit, other agencies, people like me, also promote their toolkit. So has there been sort of like dissemination, diffusion of the approach across other countries, or even within the countries in the project, to other agencies taking up the content of your toolkit? So what have you done to promote use? How's it being used? And has that use diffused beyond yourselves and the agencies you engage with? Patrick.
Okay, thank you very much. Thank you very much, Howard. So the toolkit actually is still very young, but we are actually amazed at how many people are already taking it up and how many countries are interested in this toolkit. We actually have ongoing all of this week regional conference of people from the ministries of education and academia from the 4 countries meeting in Yaoundé as we speak, looking at how they can use more of the toolkit. There's a lot of demand for it, but the use of evidence in practice is something which is new in this community and has not been so very much used. And I think, as you said, one beautiful thing about this toolkit is that the way it is presented is actually presented in a policymaker or a practitioner friendly approach. So it's easy for the teacher to have a look at an intervention and be able to tell that this is how much evidence is behind it, and this is how much impact I will get from it, and this is how much money I need to put into it. So the policymaker will basically be able to tell what's the value of their money in using a particular intervention. So our outreach, we are starting, this conference is mostly a capacity building process for these people, and they have with them certain objectives or certain indicators that they must meet by the end of 1 year. And this is using an audit and feedback approach, which is another approach that we had used in healthcare at eBase, which we are now transferring into education as well. The people from the ministries will be expected to audit and give feedback to teachers on how much they are being compliant to research evidence. So this is one of the ways that we believe that we are going to mobilize this in the education sector. And as I said, this has been used in healthcare in the past, but in education, this is quite new. Thank you. I hope that covers the question.
Okay, thank you. Yes, and I see you're actually wearing an EEF eBase shirt. So
Yes.
you actually do go out to promote in various ways, including what you wear. Okay, great.
Yes.
So there's a Patrick from Chris, from Patrick, which Chris has asked to answer verbally. So, which is fine, of course. So it's on what can researchers do to increase uptake, transferability of evidence. Chris.
So I think if an evaluation is basically trying to transfer evidence and inform practice that's in the same, more or less the same time, more or less the same place, more or less the same population, then evaluation kind of achieves that. You know, it estimates the impact of an intervention, and that's very useful for the local policymakers. But I think if it's trying to transfer evidence to a different time, like, you know, a future time, or a different population or a different setting, then I think at the moment evaluation is radically misoriented. And the issue is that interventions basically are just sets of activities and sets of resources that are there to trigger mechanisms which generate outcomes. You know, and you shouldn't mistake the intervention for the mechanism. And the same interventions might try and address an outcome using different mechanisms, or you might have different interventions that try and address an outcome with the same mechanism. So confusing interventions and mechanisms means that evaluation can be quite a blunt tool. So an example of this is we did a trial of a whole school intervention to reduce bullying, and it had various components. It had a sort of group of staff and students working together to decide policy. It had social and emotional learning in classrooms, and it had restorative practice where you try to solve conflicts using talk and getting kids to take responsibility for their actions. And so these were three components which more or less mapped onto three mechanisms. One would be increasing students' sense of belonging in school. In other words, so they'd feel part of the school and want to stick to the rules. One would be improving their social skills, so they negotiate conflict better and avoid conflict in that way. And the third one would be owning up to the responsibility to be a nice person and not bully people. And if you just done a sort of conventional evaluation, all you'd have found would be in an effect size, and you'd never really know which of these mechanisms are important and whether those mechanisms play out differently in different contexts. So we did the overall trial, and the trial had a positive result overall, which is really important in terms of public health because we care about overall effects. But kind of more importantly, we did various moderation and mediation and qualitative analyses, which showed that in schools that were kind of high capacity schools that didn't actually have that much of a problem with bullying in the first place, it was the belonging mechanism generated through staff and students talking to each other that really seemed to account for any reduction in bullying. But in more stressed schools that actually had more problems with bullying to start with, that was just too complex a mechanism to launch at that point in the school's development. And what was more important was basically just restorative practice, stopping bullying in its tracks, getting the bullies to take responsibility for their actions. And that's how it, you know, so by doing this much more sophisticated analysis, which was a moderated mediation analysis, it showed what different kinds of schools in different settings are likely to prioritize. And so that's the kind of, I think, the kind of evaluation we need to be doing, which thinks much more about mechanisms. And it comes back to the thing in my presentation, which was the purpose of a randomized controlled trial isn't just to say this intervention works, this intervention doesn't work, because that's just incredibly blunt and not very intelligent. It has a use, but it has a limited use. And really what RCTs, like any science, should be doing is telling us what our theories are and whether our theories need to be updated or refined or augmented. And you know, the purpose of scientific research is to inform scientific theory, and evaluation isn't any different. And of course, you know, talking to a policymaker, they're going to say, you know, I don't want 5 pages of theory. I want just you to tell me what to do. But the scientific theory is the way to actually do that and provide a much more nuanced picture. It can still be done using a randomized controlled trial with good internal validity. There's no trade-off necessarily between external and internal validity, but we just need to start thinking about these things in a much more context-based way.
Yeah, thanks, Chris. So I mean, from my side, a couple of comments on that, and I'm going to come back to all three panelists. So for some time, I've distinguished between first generation, second generation questions. And first generation questions is just, does it work question? The second generation questions are about what different design elements you might use to make programs more effective. But I've started to see also that a bit differently now, or at least an additional aspect to that, which is precisely trying to use the design in a way that does identify and test or validate the causal mechanisms. So because we're doing this work in mid-level theory, I've realized there are three ways in which theories of change, mid-level theories are drawn. So the most common one is, and this is do what's in the boxes. So the most common one is to put basically indicators in the boxes. So you've got indicators related to activities, outputs, between outcomes and final outcomes. And the moderators might come in the assumptions if they come anywhere. The second one, which I've done myself before, is sometimes we actually put in the boxes the assumptions. And the third possible one, which I've not seen, but I've been trying myself, is to put in the boxes the causal processes. Because normally the causal processes are just like in the arrows. And we've got this really nice little paper by Rick Davis on, you know, you have to think about your arrows because your arrows can mean lots of different things, you know. And so when people criticize theories of change being, oh, they're linear, which is like a really a curse word. Of course, I mean, it's linear. I mean, it's actually not true, but it depends how you interpret the arrows and draw your arrows. And arrows might be probabilistic relationships we typically have in econometrics or epidemiology, but they might also be necessary and sufficient conditions like we have more in qualitative research. So there's a whole lot of stuff you can do with the arrows, but you have to do an intelligent theory of change and really think about the causal processes. And the work we've done with, particularly with Nancy on mid-level theory in CEDIL, has got me paying much more attention to being explicit on causal processes. And I'm doing a couple of, well, 3 separate pieces of work now, looking at evaluations. And we actually have a CEDIL workshop next Monday or Tuesday on evaluating causal claims. And the main thing is that most evaluations don't actually make them explicit or even state what the basis is for their causal claims. So it's, I think it's a really fruitful area of research. So I have a question for all three of you, and then I'll also ask Annette to come in on it. And then, but feel free to make any other comments or questions for other panelists, comments on panelists as I go around you, because we're only 10 minutes left. So there was a question on strength of evidence. So on your slide, Sherry, you actually in the card you have some information about strength of evidence. So the question is, how do you assess strength of evidence? That's for you, Sherry. Patrick, same question, you didn't address it explicitly, but how does strength of evidence come into what you present as being the evidence or what works in the toolkit? Chris, a slight different wording for you on how should strength of evidence affect our views of transferability. There's a certain point at which we say, that's just rubbish. We shouldn't think about transferring. That's just rubbish. And this is controversial work by Lance Prish and Justin Sandfer a few years ago saying, you know, bad quasi-experimental design in your context is better than a good RCT in another context. And so reflections on that. And then Annette, whatever you wish to say. So Sherry, you first.
Okay, thanks. Strength of evidence. I think it's multi-pronged for us, right? So strength and quality obviously are important. So most of our work where research has been done, it's usually single studies or maybe a cluster of studies that are related. In very few intervention areas for the context and populations with whom we work, do we have massive systematic reviews that, you know, are relevant, immediately relevant. However, looking at the strength of evidence, one of the first things we look for is how closely relevant are the studies and study contexts to the ones that we are operating in. And as I mentioned before, you know, just saying that a study or a systematic review includes studies from, say, Kenya, Uganda, Tanzania, for example, all countries in which we operate, is not sufficient for us, given the very many different types of operating environments within each of these countries, right? So working in, you know, urban slums in Nairobi is very, very different from working in Kakuma and Dadaab, right? So, and we work in both. So for us, definitely understanding where, what populations, even what part of the country the studies come from makes sense. Obviously, we look at volume. So replication, of course, is also important for us, right? Not having one study on one population on one intervention is great, but we'd love to see many that are comparable. And then we have a number of other criteria, right? So we have the relevance, we have the volume, but we also have the methodological rigor looking at the quality of the approach itself, mostly, of course, quantitative, but increasingly qualitative and, as people would say, mixed methods, doing that type of critical appraisal and assessment. And then we also have engaged our technical teams, our technical experts, to help us to think through. I mean, they are the holders of each of these interventions, right? To think through, is the theory undergirding the interventions in these studies even clear? And two, is it valid? Does it seem to hold water, right? So for us, all of these questions are critical in assessing the strength of the evidence. We also flag for our teams, now that we're doing more qualitative, mixed methods, operational type evidence, we also flag for our teams the types of inferences that they can make, right? So where we have more quantitative, high quality, relevant in terms of context and population and all of that studies, we feel a little bit more confident around effectiveness, right? And where the theory of change makes sense and is plausible and so on. Where we have, you know, a single case study somewhere that's highly relevant to our context, but it really is just one case study with no rigorous evaluation attached, we clearly flag that, where we say, look, guys, it's highly relevant, but we're not so confident. And what I appreciate with our teams is that we're not only paying attention to the evidence that exists and that is generated not just by IRC, someone asked that earlier on, but we look at all evidence generated by anyone that's relevant for our work. But people are also making the connection between the assessment, the critical appraisal of the evidence, and the need for new research, right? So it is that same process that then signals what are the gaps around the work that we're going to do. Our default is the expectation that we'll not have very strong evidence or strong confidence in a lot of the evidence that we'll find. And so how do we move forward? It doesn't mean that we do nothing. It means that we take a small part of what we think could work. We, you know, work on the theory a little bit more, figure out the application, and we test it, right? Whether it's piloting, whether it's rigorous impact evaluation, whether it's, you know, even stronger monitoring and evaluation, routine data collection. Those are decisions that are a function of our critical appraisal as well. I'll stop there.
Okay, thank you. Any other general comments or reactions or anything you want to say to any of the other panelists? Final words? Final words.
Famous final words. Thank you, everyone. I am absolutely interested in following up with Dr. Ocwen's methodology and your platform. So I will follow up offline with that. Thank you so much.
Lovely, thanks. Yeah, I thought you seemed to have some common ground. Yes. We should be discussing together.
Absolutely.
I thought so. Yeah. So Patrick, over to you, please. Again, on the how the strength of evidence affects the recommendations you're making in the toolkit, and then also any final comments also.
Yes, so our journey with how we evaluate the quality of evidence has been quite an interesting one for the past 2 years, particularly because we were coming from a background of a grade for quality of evidence, but also we've used the JBI approach of evaluating the quality of evidence. And in this work, which was really critical that we evaluate the quality of evidence, we actually started by looking at the approach that's used by EEF. Now, why is it very tricky to use any of these approaches in our context? It's for a number of reasons. Most of these approaches were developed in a setting where a lot of research has been done, lots of randomized control trials, but sometimes for interventions that are really relevant to their context and designed in a way that can easily roll out to their context. So when we come to our context, using them became a little bit tricky. For example, the EEF approach for evaluating the quality of evidence is actually looking at the number of systematic reviews on the topic. And this is interesting because there are actually systematic reviews of randomized controlled trials or very good observational studies. In our context, it's not the case. There are topics where you would not see any research that has been carried out in the African context, or some interventions that are being used in our context that have not yet been tested anywhere. So using any of these approaches, be it GRADE or the JBI approach, was really, really tricky for us. So what we have ended up doing is that everyone, because we have different team members working on different interventions or strands in the toolkit. So what they do is they would have to defend why they want to use a particular approach for a particular intervention. And then we will build it from there, and then we'll work on that. But my belief is actually that at some point, we would probably have to be thinking about how to best evaluate the quality of evidence based on the limited studies that we have, for example. And I also want to add that it's important the evaluation of the quality of evidence using either GRADE or the JBI approach or the EF approach is still very useful, because it also gives us a benchmark of where we want to get research in our context too. And I think this is something that's very important. So that's what I can say for the quality of evidence assessment. And as per feedback to some of the other participants, I think I would really want to also say, looking at the work that's being done by IRC, the International Rescue Committee, with Sherry, I would say it's typically speaks to the African context, looking at things around safety and security in schools, social and emotional learning. I was really happy to see this in the work that she was doing. And I got the impression that there are some things that we could really use from that work. And I'll be happy. It's a good thing that we were already resonating about getting in touch. So I think we will follow through with that. So that's mostly what I want to add. Thank you.
Okay, thanks so much, Patrick. And Chris, over to you again, final words, but also how strength evidence might condition your view on transferability.
So what I'd say is, evaluation has to be good science. So you have to work out what your question is, and then you have to design your design to answer that question. And the question shouldn't just be, does this intervention work? The question should be, what are the mechanisms, what are the outcomes, and how do we think the mechanism is going to play out differently with different contexts, which might be place or population or whatever. And then you need to design your experiment to answer that question. So you probably need to have purposive diversity according to the kinds of populations and settings that you're working in, so you can understand how the mechanisms play in different settings and populations. And you need to state what your hypotheses are. You need to understand what your middle range theory is. You need to work from that in terms of what are your hypotheses. And then what I'd suggest within a trial you need to do is do some qualitative research to understand how the participants in the case, in the settings, whatever they are, how they understand the mechanisms to be. Use that to refine your theory and your hypotheses, and then test it using a mixture of moderation and mediation and moderated mediation analyses to understand what's generating what outcomes where. So that's, and I'm completely a randomista. Like, if you can do a randomized controlled trial, do a randomized controlled trial. I've done quasi-experimental, and it always leaves you uncertain unless you can expect a very big effect size. People say, isn't a good quasi-experimental study better than a bad RCT? And I go, well, maybe do a good RCT. That might be the answer to that problem. Sometimes you can't do RCTs, and we can't magic our way out of that. Sometimes you have to do quasi-experimental or before and after. It's not as good, but if that's all you can do, of course you should do it. For some questions and interventions, quasi-experimental is good enough. If an intervention is cheap and easy and uncontroversial, and it's extremely unlikely to cause harm, then a weaker evaluation design will satisfy policymakers. But if something is complex and controversial and costly, or it might cause harm, it's really important to do as thorough a randomized controlled trial as you can do. And then thinking about synthesis, at the moment, syntheses tend to pool the effect size of lots of interventions which are more or less similar in a diversity of settings, and then pop out an answer of a pooled effect size. I think that's more or less useless. I do it myself because that's kind of what you do in systematic reviews. But what we should really be doing is moving towards using meta-regression within our systematic reviews. And so that primary studies where they consistently report questions of population and setting, you can start to use those variables in meta-regression analyses to really understand what works for whom under what conditions. No single trial can ever give you very good information about transferability. You have to have multiple trials, not just to confirm replicability, but to see what works in different settings. So a systematic review gives you much more nuanced information.
And any other final words?
No, that's it.
Okay. Thanks a lot, Chris. So I entirely agree about reviews, of course, and ideally reviews allow you to get to this variation in population context, design elements, so on, to look at heterogeneity. The problem is studies don't report that information the way it's allowed to code it, or you're left with 3 included studies for one particular moderator. So what are you going to do? So we just need more studies, please. Any funders on the call? More studies needed, more research needed. Please bear that in mind. Annette, over to you. Final words.
Sure. Thank you, Howard. And thank you again to all the panelists for really interesting presentations. I guess the one final point that I'd like to emphasize is that I think what we've learned from these presentations is not just about the transferability of evidence, but also reminders about transferring evidence. In the U.S. foreign assistance context, we're really focused now on locally led development, and that means that the way decisions are being made, particularly about program design, are evolving in some ways. More use of human-centered design, for example. And I think that what we will need to keep in mind is the challenge of how we can keep bringing evidence into these new ways of making decisions about programs and new ways of making decisions about policies that rightly so focus on locally led development. And I think that we saw really great examples from both Cherie, where she was talking about how we bring these to all the stakeholders and how we make sure that we're tailoring this to the discussions that we're having with different stakeholders, and the fabulous toolkit that Patrick showed us, and again, how that toolkit is specifically used to have discussions with the stakeholders about how they can bring evidence into their own decision making about policies and programs. So I really appreciate that this session has been both about transferability and about transferring evidence into policy and program use. Thank you.
Thanks so much, Annette, for those final words. So thank everyone for attending this last session of the 2022 CEDIL conference. It's been a really interesting session, some fantastic presentations. I hope you all agree. If you go now, I think when we end, you're meant to fill in, please, the evaluation form as to how wonderful everything was, particularly the chair. And I think you'll find it in another tab. I just found it. So I looked in my tabs, and there in the tab you'll find the evaluation form. But who knows? So somewhere you'll find the evaluation form when we finish. So thank everyone. Watch out, look out. We've got these presentations will be posted on the CEDIL YouTube channel with links from the CEDIL website. We have an interesting series of working papers and methods papers that address many of the issues that have been raised today. So do check those out, particularly areas around mid-level theory. The program work too on enhancing transferability in mid-level theory is particularly relevant to this event today. So please do take a look. There's stuff there already, and there'll be more stuff coming out as over the course of the coming year. And there are regular CEDIL seminars which have far fewer people than we've had at these events. So do think about coming to those too. So again, thank everyone. Have a good morning, afternoon, evening, depending where you are. And bye-bye.
Thanks. Bye-bye.